Hello, hello, YouTube world. It's Miss Patty with For Your CNA, and welcome to this week's live question and answer session, where we're here every Thursday at 3 to answer questions related to CNA training, CNA testing, and the CNA workforce as well. Let me get set up here. I'm just going to pull my chat out so I can take a look to see who's here. So when you come in, make sure you give me a quick hi or a wave or a thumbs up or something so that I can see that you're here and welcome you. If you have any questions, make sure you put them in the chat as well. So as you guys know, when we first get started, I'm just going to pull this over here. There we go. Okay, so when we first get started, I generally give a little lesson to talk about a topic that's relevant. Hi, Fred. Thanks for joining us. So this week, I want to talk about something that I actually saw on Facebook. So I'm plugged into a whole bunch of CNA groups on Facebook. And one of the questions on there was somebody that wanted a little bit of guidance from other CNAs. So I want to talk, I'm not going to read the actual post, but I want to talk about this and kind of discuss it with you guys and see if we can maybe shed some light on this problem. Okay. Hi, Susan. Oh, I'm sorry that you missed me. I'm so glad that you're here. Lizzie, hi. Sephora, hello. So here is the gist of what was being said. Okay. So this is regarding call offs. Can you guys hear me? Okay. I hope you guys can hear me. If you can hear me, let's see here. If you guys can hear me, put a thumbs up in the chat. Let's just make sure that I'm coming through okay. Can you guys hear me? Hi, Patty. Hi, Seneca. Susan says, yeah. Okay, good. All right. So here is the gist of what this person put in the post, right? So this is for agency. Now, for those of you who don't know what agency is, I did a whole lesson on it last week, but agency is kind of a substitute CNA. Okay. So when a facility doesn't have enough of their own staff that's hired through them to cover all of the shifts, then they will have, they'll get in touch with an agency, have the agency send a substitute CNA to kind of cover those shifts. So that's what an agency CNA is. Now, sometimes facilities will also contract with people to do fill-in shifts. That is usually a pool position. You still work for the company, not an outside agency. So usually if you're working a pool position, it means you're not really assigned a specific shift or a specific hallway. You're more of a fill-in person, but you work for that facility. An agency is a completely different entity that sends in substitute CNAs and nurses when the facility doesn't have enough of their own. So I hope you kind of get an idea of what an agency is. So this person's working, she was directing this to agency CNAs. So I'm assuming she's probably working agency, but here's the scenario. So she accepted a position 2.5 hours from her home. And so that's a very, very long commute. And then she moved. So now she's an hour outside of her facility, the main facility that she goes to. So I don't know whether she's on a contract or whether she's just doing fill-in. I'm not real sure, at one specific place. I'm not real sure. But she's now working an hour away from home. And that's interstate driving. Okay. So it's quite a distance away from her facility. So she accepted this position. Now, because she moved from 2.5 hours to an hour away, so it's quite a distance of a move, she doesn't have the money to buy a new vehicle, right? So she's stuck with this older, not broken down, but older, unreliable truck that she's got to make this huge, long commute with, right? Eats up a lot of gas. So a couple of days ago, she wasn't feeling well. She didn't want to expose the patients to whatever it is that was making her feel icky. So she called off. And now they're having like a snowstorm situation, and she doesn't feel safe going in because of the conditions on the road and her truck and it's such a long commute. So she's just not really feeling comfortable with making the trek to work. So She lives an hour away. It's a long commute, an older, unreliable vehicle. Gas is high. She's already called off twice. She's calling off again. And she's trying to figure out if, kind of, is it, so this is the question she asked. So let me read you the actual question that she asked here. Is it right for them to get upset with me due to things that I can't control? And if I don't feel safe driving so far for an 8-hour shift when they do have workers? Okay. So that's her question. So her scenario is that she lives far. She is driving an unreliable vehicle. She's already called off twice. And is it fair for the facility to penalize her for these things that she feels are out of her control? So that's what I kind of want to talk about right now is call-offs, right? And what's the company's responsibility, what's our responsibility, and who do they actually affect? And does our personal situation really enter into it at all? So that's kind of what I want to talk about here. Let's see who's here real quick. Sultanis is hi. Catherine, hello. Debbie, hi. Yvette's here. Ollie 66, hi. Gloria, hi. And Blue, of course, is joining us again. So here we go. So let's talk about employment in general, and then we're going to kind of switch over to call-offs. So when you work in healthcare, it's not like Walmart, right? If we don't have enough cashiers show up at Walmart, they just shut down a checkout lane, and you will probably go through the self-checkout, or you'll wait in line or whatever. It doesn't really adversely affect the performance of the facility if they don't have enough workers. They're just going to make their customer base, either do it themselves or wait a little longer, whatever the case may be. Now, this is different in healthcare because remember, our patients, right? Our patients, the people that need our help, can't do these things for themselves, because if they could, they would. They'd be at home, they'd be taking care of themselves. We wouldn't be involved, but they can't. So they're in a position where they have to have somebody do these things for them. It's not it would be nice if. This is, we have to have this help. So in healthcare, when we're taking on that position, we're understanding that, yes, I understand I've got my own personal life going on. I got a lot of things, that's in the background, but I understand that my position, by taking this position, by agreeing to work here, I understand that my performance is necessary for the well-being of the patient and the continued operation of the facility, right? So healthcare is different. We kind of have to understand that. It's not like other industries where if we call out, it's not going to have this huge impact. When we call out, it has a very big impact on the facility, the way it operates, and the patient ultimately. But it also has an effect on the other coworkers, because if we call out and we don't give them enough time to be able to call an agency and get somebody to come in, now we're working even more short-staffed. And guys, everybody's starting out short-staffed. There aren't enough CNAs to go around. There just aren't. If we had every CNA that's currently certified in the United States working at full capacity, we are still over 100,000 CNAs short. So we're working short-staffed already. And when we call out, now we've got another position that is not staffed. So that means the people that are there are spread even thinner. So this is going to affect staff morale. And this is going to affect how, how coworkers relate to one another. Like, I'm not going to be best friends with somebody that's calling out 3 times a week, because that makes my job a whole lot harder. So we have to understand that affects the company morale, but it does something even worse, right? When you're working short-staffed all the time, it gets to you. It wears on your soul. It's like, there's no way I can get everything done. I can't take care of the patients the way I want to take care of them, the way they need to be taken care of. There's just not enough people to go around. And when this person over here is calling out all the time and nothing ever happens to them, it just makes me not want to work as hard, because why can they get away with it? And yet I'm busting my butt and nobody's even, recognizing the fact that I'm going above and beyond. So it affects company morale. And nothing will kill a facility quicker than the bad morale of staff members, because people just stop caring. They stop showing up on time. They stop, the diligence is gone. They're not paying close attention to their patient. It just kills a facility. So we've got to be really, really careful with that, right? So there's this thing in healthcare where when you accept a position, you have to know that you matter, you count, that what you do is very important. And if you're not there to do it, somebody else has got to. We just can't ignore it. Somebody else has to. And if there's nobody to do that, then our patients are ultimately going to be the ones that suffer. So the question is, that she asked is it fair for them to hold this against me, things that are outside of my control? So let's look at that for just a second, because that one statement really kind of impacted me a little bit. So things that are outside of her control. So the fact that she accepted a position an hour away from her home, or actually initially 2.5 hours away from her home, and then she moved a little closer, but she accepted that position. So that was not outside of her control. So she knew when she accepted that position that she had a vehicle that was not necessarily reliable, and she accepted the position anyway. That is not outside of her control. She knew that when she accepted the position, right? Am I right? So she accepted a position far from her house with an unreliable vehicle. Now, the fact that she was sick for 2 days, that really doesn't I get it. I get it. You're sick and you don't want to expose your patients, and that's excusable. I get that. But the fact is that other people had to pick up her slack for those days that she wasn't feeling well. And now she feels unsafe driving that far distance in an unreliable vehicle to get to work. And that's going to further inconvenience the staff members that are there and the patients that probably aren't going to be receiving good care. So the question is it fair for her facility to hold that against her? And my take on it is, yeah, it is. And furthermore, if the facility doesn't do anything about this, it's going to affect the rest of the CNAs that actually showed up. Because those CNAs who show up and do their job, if they see these other CNAs calling off and not showing up, it doesn't matter why. The reason for the call off, totally irrelevant, because at the end of the day, it's the patients that have to be taken care of, and it's the managers that have to run the staff and run the facility and make sure everything is happening correctly. So if we have a CNA, doesn't matter why they're calling off, the personal situation behind that is totally irrelevant. The fact is that we don't have enough staff to take care of these patients. And if that person that keeps calling off doesn't have a consequence to that, then the other CNAs that are there are going to feel unappreciated, undervalued, and eventually they'll just get to the point of, why am I even trying? So is it fair for the facility to hold this against her? I think, yes, it is. Not only is it fair, I think it's necessary for the good of the facility. Now, when we accept a position, we have to think about our responsibilities in accepting that position. It's not just about a paycheck, right? When you agree to work for someone, you're saying that I am going to give you my time and I'm going to accept these responsibilities in exchange for a paycheck, correct? So you're agreeing to those responsibilities. And part of that is to make sure that you're diligently trying to follow the rules. If you're not going to be able to be there, if you're accepting a position that's far away from your home and you don't have the transportation to get there, then to me, it seems like maybe it would be a better fit to find a facility closer that you can get to, that you can acknowledge and adhere to your responsibilities in accepting that position. Does that make sense, guys? Does that make sense? So when you're accepting a position, now this goes right along with what we were talking about last week. Because last week we were talking about agency nurses and how, or agency CNAs, and how some places are offering $30 an hour, $35 an hour. And that's very tempting, guys. I'm tempted by that. I am tempted to leave all this and go back to work in a clinical setting because they're offering to pay me big bucks. It's very tempting. But the thing is, you have to look at the responsibilities behind that money. And you have to find out, am I able to fulfill those responsibilities? And if the answer is no, then it doesn't matter what the money is. If you can't perform adequately, then you really have a responsibility to not accept that position because they're relying on you. Now, those of you that are in healthcare, all of you guys listening, you need to be recruiting. Guys, we're 100,000 CNAs short. If all of you recruit somebody, that would help, right? If you tell people, oh my gosh, I've got the best job in the world, you should be a CNA. You've got a caring heart. You're compassionate. You would make a great CNA. Come here. Let me show you my school. Let's get you a CNA. Let's get you into my facility. Man, we would be fully staffed. Nobody would be understaffed. Everything would work great. And your facility that you're working for would probably become a dream facility to work for because they've got all the staff they need. But if you're at home complaining to everybody, oh, I hate the place I work, it's horrible, we're always short staffed, nobody seems to care, and you're always talking down about what you do and how you do it, then why would anybody want to join you know, that industry? So be careful of how you're portraying your industry. If you know somebody right now that you think, man, they would be a good CNA, you need to go talk them into being a CNA because we need them. We need them. And you got to be careful about how you're portraying the industry too. We need to be recruiting, not rejecting. Okay. So be careful there. But when you're looking at potential job opportunities, whether it's agency, whether it's a facility, whether it's independent, whether it's home care, no matter what it is, when you're looking at a potential workplace, you really do need to be thinking in terms of your responsibility in accepting that position. Do I have what it takes to be here consistently, to show up on time, to take care of the patient in the manner that they need to be taken care of? Do I have the skills, the ability, and the resources to fulfill my obligations here? And if the answer is no, this might not be the best opportunity for you, no matter what they're offering and pay, right? But the other person that this is affecting is her. If she's living so far from the facility and it's a hardship on her to drive that distance, especially in bad weather, then maybe, the big money that they're offering her isn't going to be worth it in the long run if she can't work those hours. So call-offs, who do they affect? They affect everybody. They affect the person that's calling off because they're not getting paid. They affect the facility because the facility is going to, the morale is going to suffer. They affect the other CNAs who have to pick up the slack. And ultimately, the really hard part here is that they affect the patients that person should have been there to help and isn't. So everybody is affected by a call off. The reason for the call off is really irrelevant. It doesn't erase all of that effect. It just doesn't. So whether you've got a good reason for calling off or you just want a beach day, doesn't matter. The effect overall is the same. The patient isn't going to get the care they need. The facility is going to be short-staffed. Morale is going to suffer. You're not going to get a paycheck, and your coworkers are going to become resentful. So if you're tempted to call off, think about it really hard. Is this worth all of that cost? Now, if you're sick, please don't go to work. We don't want our patients to be affected, right? To be sick. Make sure that you're getting good exercise, that you're managing your stress, that you're eating well, that you're getting enough sleep, all of the things that we can do to keep ourselves healthy. But if you are sick, make sure that you give them plenty of notice, but don't go to work. But if it's something that is controllable by you especially when you're deciding what areas you're going to want to work in. Keep these things in mind. It'll help produce a much healthier facility for everybody to work in. It'll produce better outcomes for the patients. And ultimately, you'll be happier because you won't be facing these serious moral dilemmas. This really affected this individual to the point that they put it on Facebook to ask for input. So she was really struggling with this. It was really, really affecting her. And I feel for her. I really do. I mean, she's in a really tough place. But at the end of the day, it even though it's affecting her, it's not affecting just her. And we have to look at the whole picture. Hope that helps, guys. All right, so let's see here. Seneca says it's 24 hours. I'm not really sure what that means, Seneca. Blue says, with someone who has had a stroke, I know you dress the affected side first and undress it first. What is the reason you tell people to do this? Ooh, Blue, that is a great question. So the way we remember this is USA first, undress, strong, arm first, right? Undress, strong, arm first. Now, the reason for that is that when you do that, it allows the stronger arm to do all of the work. So if I've got something on that snaps or buttons in the front, so if we have somebody with a weak arm or an affected arm or a shoulder that maybe has a surgery or is injured, we tell the family to go get clothing that buttons or snaps up the front. So we want a button up, not a pullover, right? Most of our clothes that we wear are pullovers like this, they go over the head. But when you have a weak or affected side, then pullovers really aren't that effective. Side to side dressing is better because I can make the stronger arm do all the work. So let me show you. So let's say that this arm is weak, okay? This arm right here is weak. I have trouble moving it. Maybe I have a bad shoulder. Maybe I had surgery. Maybe I had a stroke. So that means that this arm is not weak. It's strong. I can pull it out of the sleeve and make it do all the work. And then the garment just slides right off this weak arm. No motion required. Now, when we're dressing, we're going to do it the opposite way. We're going to slide the garment up this arm, no motion required. And it's going to make the stronger arm reach up and back and get that arm in the sleeve and kind of shrug it in place before I button it. So undress strong arm first, dress weak arm first. That way, that weaker arm doesn't have to do a lot of the motion. I hope that helps, Blue. Susan says, I wish to find a job soon. It's really not easy here in the UAE. Yeah, different areas have different requirements and different staffing needs. So unfortunately, I don't know much about the UAE. I don't know how to tell you to look for open positions. Here in the United States, we have a lot of internet-based jobs boards, but you can go to each facility you want to work for. So if I want to work for the local hospital, I would go to their website, look under their careers tab and see what positions they have available and then apply right there on their website for those positions. You can also go through third-party jobs boards like Indeed.com or, Snag a Job or one of those, ZipRecruiter, one of those types of jobs boards. They do have some listings, but they're not going to have all of them because those jobs boards cost money. If I want to advertise a position, let's say I have an opening for a CNA, in order for me to put an ad on those jobs boards so that I have a position, it costs me money. Where if I put it on my own website, that's free. So you should go to the website of each place you want to work and look on their jobs listing to see what openings and then apply right there. You can also physically get dressed and go in and ask, are you hiring? And they'll tell you what their hiring process is. But for the UAE, I'm not real sure what the process is. I'm very sorry. I'm just not familiar with the procedures in that area. Blue says, places being short-staffed, that explains why temp agencies in my area start out as CNA at 21 to 23 an hour. For context, Washington state minimum wage is $14.49 an hour. Actually, that's a really good minimum wage. In Florida, minimum wage isn't that high. And yes, agencies are starting out at, very high amounts, 20 to $30 an hour for CNAs. And that's because we are short staffed and most places have to rely on agencies to send them temp workers. There's a lot of problems with that though, because the temp workers, the agency CNAs, they don't know the patients. And part of being a CNA is being able to recognize when Bob is just a little more confused today because he's got a UTI started. And in elderly individuals, the very first sign of a UTI is confusion. Well, if you just assume all old people are confused and you don't pay any attention to the fact that Bob is confused today, you're going to miss that. And now we've got an infection that's not being recognized. Or if you're an agency CNA and you've never seen Bob before, you might think this is normal for Bob. So having consistent staff in place is essential to be able to notice changes in the patients throughout days, weeks, months. If we can't notice there are changes, then we don't know when situations are happening, and we don't report those things for the nurses to be able to investigate further, to do assessments. So when you have staff that's almost entirely agency, we don't have a good handle on what's happening with the changes. And that's why a lot of things get missed. And you'll have patients with strokes that go undetected because nobody knew that they were perfectly normal yesterday. There isn't a single person on staff here that saw them yesterday. So we don't know that what we're seeing now is abnormal. So it's really essential to have people in place that know the patients, that can recognize when something has changed. If you're using a lot of agency, we lose that whole ability. So that's really, really frightening as a nurse to see that change in facilities. MCAT says, hi, not sure if this is asked before, but can CNAs be self-employed, work independently? Yes, you can. CNAs can work independently, but remember that CNAs follow the care plan. And if you're working independently, who's writing the care plan? So you would have to get your instructions from the families or the patient. And that doesn't necessarily work out really well because it can turn into a he said, she said type of thing. So yes, you can work independently, not necessarily legally, but you can work independently. You just have to be very, very careful. Be very careful. So give me 1 second. We're going to get rid of some of these. All right. Okay. So we're going to, okay. All right. We got some spam on here. Sorry, guys. Okay. Let me see here. Am willing to work but can't find. Oh, okay. So Susan's talking about the job in the EAU. Let's see. Oh, there are a lot of CNAs in the UAE without a job, including myself. This is so funny. I'm so sorry to hear that. It sounds like you've got a great heart, and Manuela, and you really want to work. I wish I could give you more input. I'm not familiar with the area. Hi, Amarachi. Catherine says, yes, you make sense, but it's still untold hardship on her. Yeah, I agree, Catherine. It is a hardship on her. Absolutely. But I guess my point is that when we're accepting these positions, we need to be mindful of those hardships, right? Are we willing to endure those hardships consistently, or are we just going to not go into work if the hardships are just, if we don't have a plan to overcome them? So I think my point is, yes, I feel for her. I really do feel for that poster because it was definitely an agonizing decision for her. But I think my point is that maybe we should do a little bit better job of evaluating our own hardships before we accept those types of positions to make sure that we're able to meet the obligation. So I think that that's our responsibility to do as well. So let's see here. Sunday says hi. Hi. Emirati says, how are you doing today? I am doing fantastic. I'm in Florida. It's rainy today, which is very unusual for the Sunshine State, but I'm doing very well. Matt says, not sure if you remember me, but I'm from Ottawa, Canada. I'm now officially a PSW nursing aide, and I'm now working. Your videos help me a lot. You're a saint in our field. Oh, thank you, Matt. I do appreciate that. I'm very happy that we were able to help you on your journey, and welcome to healthcare. But saint, I'm not a saint. I love what I do. I love helping you guys. Matt says, I'm in Canada. I find finding a job in our field with a country or city is rewarding, and they're always hiring. Plus, they pay more. I'm now making almost $27 an hour Canadian. Wow, very good. Plus benefits. Very good. I'm so glad that you found a good position, Matt. Awesome. Yvette says you could come to Florida. Every corner they turn, they need CNAs. Yes, absolutely. I don't know how to immigrate to America, so I don't know what the process is to be able to immigrate from the UAE to Florida. But yes, we do need you. So certainly you're more than welcome to come because we have positions. Ollie says, I can have the classes at 4-year CNA and return to the state where I live to get my license because I live in Wisconsin, but I love your class. Okay, Ollie, that's a very, very good question. Very good question. So in Florida, only Florida, you can challenge the state exam. So anybody can come to Florida, challenge a state exam, and then you can go back to your state and say, hey, I'm a Florida CNA. I'd like to be a CNA in Wisconsin, I think is where you're at. Is that okay? And some states will say, yes, absolutely. You've got one in Florida. We'll give you one here. Everything is great. Go to work. Other states go, hold on, not so fast. You may be a CNA in Florida, but here you have to go through our testing or you have to go through our training. So every state's a little bit different in how they handle reciprocity. That's the term for transferring a certification from one state to another. It's called reciprocity. But how do I put this? It's not a good practice to just come to Florida to get certified and then go somewhere else, because laws are different in different states. And that's why most states require that you go through their training, because they want to make sure that you understand legally what you're allowed to do and what you're not allowed to do in that state. So I love the fact that you love my instruction, and thank you very much. But you really do need to attend a training program in your state. Now, I will tell you that there's a lot of schools out there that are using our book and our videos and our online course as part of their curriculum. So even though you're not in Florida training with me, if you get into a school and you may be surprised because you may be issued my book, and you may see me up on the big screen as the instructor is teaching skills. So don't be surprised if I show up at your school, through these resources. Indirectly, you are still training with me. You're just doing it in your location, not mine. Hope that helps. So yeah, we're actually becoming way more popular out there in schools. So it's not unusual to see our materials everywhere. So let's see here. MCAT says okay. Catherine says okay. Mumina says hi, Miss Patty. Hi. Julio says, I'm applying to a local nursing home as a CNA in New York, but I'm scared since I had a bad experience in the past. I'm so sorry to hear that, Julio. I really am. I'm glad it didn't scare you off, though. What I tell my students is not every place is the right fit. Just like, remember when you were dating? Some of you still are dating, and that's okay. But remember that when you're dating, you're trying to find somebody you're compatible with. And it's not always the first person that you meet. You go out on a date, you're like, I don't think so. This isn't working out. Another person, you might go out on 3 or 4 dates, and then you're like, we're just not quite right. I'm going to keep looking, right? Dating is all about trying out a few different personalities to find the one that fits you the best. Well, employment is kind of like that too. You're not always going to pick a winner the first time out of the gate. You might get into a facility, you go through a brief 15-minute interview, you take a look around, you meet a few people that work there, and then you have to decide whether you're going to marry this place. Are you going to sign up to and agree to spend 8 to 12 hours of your day there? Right? That's a huge time commitment. You spend more time at work than you do with your family in a lot of cases, because most of your family time you're sleeping. So, yeah, it's hard to tell in a 15-minute interview whether you guys are all going to be compatible, and you're not meeting everybody that you're going to be working with during that interview. So it's sometimes really easy to find a bad place. Think of it like a bad first date, right? You went in, you got hired, you go to work, and you're like, oh no, this is not right. This does not work for me. That's okay. You can go somewhere else and try again. The old saying is you got to kiss a few frogs before you find your prince. And sometimes that applies to healthcare too. I wish I could say that everybody found the perfect place the first time they went to work. But sadly, it's just not true. There's different cultures inside different facilities. There are different teams that work well together. Some don't. There's different management. There's a lot of variables there that will affect how you feel about your workplace. But if you don't pick right the first time, it's okay. Find a new place. Don't give up on healthcare, though. Just give up on where you're doing healthcare. Go find another frog. See if that one works. Okay. Catherine says, I want to move a step higher from being a CNA. I'm eager to move higher. Certainly, there's lots of career paths in healthcare. It's not all nursing, although I'm partial to nursing for sure. CNA, LPN, RN, and above. Absolutely. I don't teach LPN. I don't teach RN. CNA is my baby. This is where I belong. I love hanging out with you guys. I love sparking that interest in healthcare and helping you navigate and figure out what your next step is, or what the right step is for you right now. Or, how do you pass the test? That's my niche. That's where I blossom. So no, I don't do anything for LPN or RN, but I will wish you well, and I will encourage you to keep going. But it's, nursing is not the only track out there. There's lots of other things in healthcare. There's dietitian, radiographer, people that run the CT scanners. You've got lab assistants who they don't draw the blood. They look at the blood and they evaluate it and come up with numbers that the doctors use to make decisions. Or maybe medical records is a better fit for you if you're an organized, orderly type of person. Or maybe ultrasound might be more up your alley. There's a million different opportunities. Biomedical engineer, that's the person that keeps all those machines and all the equipment in healthcare running smoothly, because you don't want any of that to not run. That could be a catastrophe. So there's lots and lots and lots of opportunities in healthcare beyond nursing. So take a look around, make some friends, figure out where you might have an interest and investigate that. Okay. So let's see here. Is it acceptable to study as a CNA in the UAE and also be allowed to work in the United States with the same certificate? Well, Debbie, I don't know, because in America, each state has their own certification process. It is not one certificate for all of the United States. And I don't know anything about immigration. So I am not the person to come to for those answers. I simply don't know. I don't know whether a CNA certification from the UAE would allow you to immigrate into the United States. I don't know. I'm sorry. So let's see here. Hi, Miss Patty. This is from Helen. I love your classes very much. Live in France. Wow. And I follow your live question and answer every Thursday. I want to purchase your books because I'm preparing to take the CNA class. Oh, Helen, I appreciate that. I do. We actually right now do not ship internationally. We're still very small. Guys, you wouldn't believe it. I mean, we really are very small. There's just 4 of us. That's it. I do all of this, right? All of the content. I have somebody who handles all of my shipping. My husband handles all of the finances and accounting and all of that. And then we've got somebody who runs our retail store. So there's only 4 of us. We're very small. So I don't ship internationally right now. It's something that I am looking at doing somewhere in the future. But I'm so sorry, Helen. We're just not going to be able to help you with that. But thanks for coming. I hope you still join us. Maddie says, thankfully, I passed my CNA exam and now I'm an LPN. Oh, or you're in LPN training. Very good. Me and my class always watched your videos and I would have failed without them. Well, thank you, Maddie. I appreciate that. And congratulations. Keep going, man. It's awesome. Awesome. Maddie says our entire class passed. Yay. That's awesome. Gloria asks, can I add medication technician certification to my CNA? Sure, absolutely. That is an appropriate additional certification to get. Again, every state's a little bit different on how they do their med tech training. And I can't really give you any more direction because I haven't done all of that research yet. It's something that I am working on though. Let's see here. Lafania says, hi, Miss Patty. I passed my skills exam thanks to you with your video. Thank you very much. Thank you. Catherine says, biomedical engineering, is that higher than a CNA? Yeah, well, it's not that it's higher than a CNA. It's a totally different track. That's like saying, is a radiographer higher than a CNA? It's a different field. It's a different track. It's still in healthcare, totally different field. So they're not equivalent. It's not that one's higher than the other. There's more education required, yes, but it is very interesting. Queen Stella got your certificate. Congratulations. I know Queen Stella's been with us for quite a while. Ollie says, last week, my 2 CNA skills study guidebooks arrived because I bought one for myself and one for a friend. Oh, that's awesome. Thank you. Thank you. Maria says, what are good tips for studying classes? Maria, I'm going to save that till next week because we're almost out of time now. So next week, we're going to talk about studying tips. Okay. So tune in for that. Next week's going to be all about studying tips because I got some good tips for you. Debbie says, thank you. Maria says, also, your videos are very helpful and informative. Thank you, Maria. Janine says, I take my CNA exam soon. Your videos have been so helpful. Well, congratulations. That's awesome. We're super excited. And we're going to send out tons of good vibes to you, Janine. You're going to do great. And Celiana says, hi. All right, so let's get to this part of our session where I congratulate those that drop by and let us know that they passed the state exam. And if you're testing soon, make sure you drop by to any of my comments or any of my videos and drop me a comment that says, hey, I passed, so we can congratulate you. Make sure it's a new comment, though. Don't comment on somebody else's comment because I don't always see those. So a new comment, just say, hey, I passed. So this week, we want to congratulate Rossi Davila, who passed the CNA exam last week, dropped by to let us know. And Chanel Pinto also passed the CNA exam last week. Let us know. Now, people that are testing soon, Anisha is testing next week. And Deborah is also testing soon, and she had a question that I wanted to answer really quickly. She said, do you have to wash your hands before and after every single skill? Because she was taught to in class, but my videos were unclear. Yes, you must physically wash your hands before and after every single skill you do. Now, at some point in that skills test, they're going to tell you you can simulate hand washing. That's what you see on my videos. I always say I'm going to go wash my hands. I turn around to the sink, and then the video cuts back, and I say I have clean hands or I've washed my hands. So that's what you're seeing on those videos. Yes, you must wash your hands during the test. They will tell you when you can simulate, and simulate just means say. But that's, for any patient encounter, you have to wash your hands before you touch the patient and after you're done with your skill. And then Benti Athoa dropped by to say that she's excited because she's starting classes in August. And that's a long way away, but she's already preparing. So that was really cool. So we're going to wish her lots of luck and hope she can join us on some of these sessions. So Let's see. Helen says, "Are your books on Amazon?" No, Helen, I'm so sorry they're not. It's only on my website, but I'm going to work on looking at international shipping because we got a lot more people that are asking about that. I'll see what's required, and we'll see what we can do to help you out. Okay. And P says, "Thanks for the class today." Nancy says, "Your videos are really helpful." Janine says, "Do you have to check the side rails and locks on the bed every time as indirect care for every skill?" The answer to that, Janine, is it depends on what state you're in. If you're testing with Prometric, no, those are not tested checkpoints, but there are a few states out there that do test those as safety checkpoints. So, go with the state that you're in, whatever the guidelines are for the state that you're in. And I'm actually doing a research project on that right now. I know, in my spare time. This is what I do for fun, people. I need to get out more, right? But I'm actually comparing the testing standards for all 50 states to see where the differences are. So it's a really, really big research project. So give me some time, but we'll help you. Okay, Janine, you're in Florida? No. Florida's prometric testing. Side rails won't even be on the bed. You don't have to check the locks because they'll already be engaged and nobody ever unlocks them. So you're good. Okay. I hope that helps, Janine. All right, guys, that's going to wrap it up for today's session of our live question and answer session. As always, join us here every Thursday at 3. And we're here to answer your questions on CNA training, testing, and workplace. Whatever you've got, we'll answer. And next week, we're going to talk about studying tips. So let's see here. And that's from Maria. So I'm going to write that down. Maria's studying tips. And that's what we'll talk about next week. If you've got a subject that you want to suggest for a weekly lecture, make sure you let me know. Start thinking about it. Put your thinking caps on. Start thinking about things that you would like to know more about because this is your session. I'm here to help you. All right, guys, I will see you next week. Until then, happy caregiving.